So India is really an incredibly dynamic place. I mean, it is a country of 1.4 billion people, representing 1/8 of the world's population. And I think if you can solve a health problem in India, you have global impact, just by definition.
So one of the first projects we were involved in was to identify new cases of HIV transmission in India. This was back in the early 90s. Understanding how infectious disease affect populations in India not only help India, but help the rest of the world where those same infectious diseases are an issue.
The collaborative research between Johns Hopkins University and the Indian academic institutions began over 3 decades back, has exponentially grown over the past decade or so. We have partnered with multiple Indian institutions such as BJ Government Medical College, Dr. D.Y. Patil Medical College, Hinduja Hospital, Medanta Hospital, and YG Care in Chennai, and many other Indian institutions. We have developed a research cadre that consists of over 200 trained research personnel, including clinician researchers, research pharmacists, data managers, laboratory technologists, and so on. And we also have an in-house regulatory expertise for all kinds of research.
There are a lot of firsts, obviously, on the research side through this collaboration in Pune. The first treatment studies, the first prevention studies, all of those first happened in Pune through this collaboration.
So I think one of the things I really have learned is there's nothing we can do without partnerships, right? And it's not just about academic partnerships, but I'm coming to realize that you have to have partnerships with government, with community, with academia, with not-profit, and these days even with for-profit industry, right? Because they are the ones who are coming up with the technology. So Accelerate is a USAID PEPFAR funded award for $50 million. I think one of the biggest successes of Accelerate so far has been the Mitra clinics. So these are comprehensive care clinics for the transgender community in India. These are probably the first transgender clinics in India that our team established. And so the way we've designed most of our programs is to really bring the local partnerships, especially the communities, as a part of the actual program. Because the one thing I've realized over the past 20 years is we don't know what the communities want. They know what they want. And so trying to work with them right from the get-go, giving them an opportunity to present data at clinical conferences, giving them an opportunity for authorship, mentoring them through that whole process, I think that really has been one of the most fruitful things.
The Center for Infectious Diseases in India is based on long-standing, trusted partnerships with reputable Indian institutions. And we've built a cadre of highly experienced, really motivated individuals that care deeply about addressing infectious diseases and are committed to the highest standards and sort of ethics of conducting research, training, and education. And so, essential to international work and success is to have that really strong partnership with trust.
Our research is deeply rooted in the community that we serve, and transparency, inclusion, and communications are critical for our research. Our research focus is based on the community needs and is of public health relevance and are guided by communities that we serve.
And if you look at the HIV program anywhere in the world, whether you're looking at it in the US or in Africa or in India, it's populations like people who inject drugs in the trans community and younger people like children and adolescents living with HIV who tend to fall behind. But what we also found was 71% of those infections were all happening in one particular location in New Delhi, like one venue. And so I went to that particular venue to see what was going on. And I saw a blue shed at this venue. But when you walked around the blue shed, we saw at least 200 or 300 people injecting, probably sharing drugs. So I went up to them and I said, hey, we have HIV testing literally like 100 meters from you. Why don't you get screened for HIV? And their question was, hey, we don't know where we're going to eat dinner. Why do we care about HIV? Right? So that really changed my perspective on healthcare. recognizing that what we think is a priority is not necessarily a priority for our beneficiaries. As researchers, we publish papers, but then we also need the community and the advocacy groups to take those papers and impact policy. Because unless the community buys into whatever you're doing, they aren't going to push for scale up. And without the communities pushing for scale up, there really is no sustainability in anything that you do.
Well, I mean, India has more PhDs than the United States. India's got tremendously well-educated scientists. And so it's a really great opportunity and a privilege really to work with such excellent people. And you know, a good partnership requires partners who have both something important to contribute to the synergy of that collaboration. So it's really effective and easy for Hopkins to work with colleagues in India because of that expertise.
With COVID pandemic, we have learned several lessons, including the need for investment in clinical research capacity building. So therefore, we are excited that we are in the planning stages of a new research center here in Pune. This is made possible by the generous donation from Johns Hopkins Gupta Klinsky Indian Institute donors as well as donors from India. This, we believe, will help advance science and will develop diagnostics, drugs and strategies that can curb the spread of infectious diseases in India as well as globally.